Thanks, guys. I'm John Wardle. Thank you, Deb, for that blush-worthy introduction. Aronah started out with like-minded professions. I guess it wasn't as nefarious as people meeting in a dark sort of cafe somewhere conspiring. It actually started out in Lismore, of all places, when Southern Cross University got a whole heap of experts from around the country to basically advise on their course, and as most people are wont to do in this profession, the conversation steered off after we got let loose from Southern Cross, and we did go out to dinner, and that's why we were actually in the same place at the same time. So one of those people was actually involved in the government registration and actually suggested this might be actually a good way to depoliticise the nature of registration in Australia for naturopaths and Western herbalists. So the actual register is based on the NRAS legislation, so the National Registration Legislation. The Constitution is entirely based on there. That will be up on the website soon. We're trying to make the Aronah website as transparent as it's supposed to be. If the information isn't up there, we may have just forgotten to put it up there. So we're not trying to hide it. If there is something that you actually want to be put up there and actually made a lot clearer than it is, please let us know, and we'll actually endeavour to get as much information up there as we can. We're trying to make this a clear and transparent process, and in fact that's actually part of the Constitution too, which you'll see when you go on there and have a look at the Constitution in a few weeks. The guiding objectives and principles are the same as the National Registration Legislation, and I'll go through those a little bit later. And the other thing just to bear in mind is, as part of the National Registration System, I don't know if you've seen a consultation paper on requirements for unregistered practitioners that's coming out. That is not consideration of individual professions that need to be regulated. That's actually a sort of catch-all piece of legislation for unregistered practitioners, similar to the New South Wales Code of Conduct, the New South Wales Unregistered Practitioners Code of Conduct, and also quite similar to a bill that's about to be passed, or is just being passed, I forget which one, but the bill that's actually gone through the South Australian Parliament currently, which is based on that New South Wales Unregistered Practitioners Code of Conduct. So there are going to be extra requirements on unregistered practitioners anyway, but these aren't going to, it's going to be a retrospective piece of legislation. It's going to be negative licensing rather than actually setting minimum standards for individual professions. So Aronah has been set up to actually help with this. The actual legislation itself, it's a move from state-based legislation to nationally based legislation. So what they've done is Queensland, the only state in Australia that doesn't have an upper house, has hosted this piece of legislation. To change that piece of legislation, every health minister in Australia has to sign off. But every other state and territory essentially has a Me Too piece of legislation in their code. So basically once you change the law in Queensland, it applies nationally, which means that once you change the medical board, for example, it applies across Australia rather than actually just in Queensland. So as you can see, because of this kind of gave Aronah an opportunity to base registration on an independent mechanism away from the associations. That's been one of the criticisms of self-regulation, is that not so much that it's self-regulation, but that it's not independent of the profession. So Aronah is not a professional association. I want to make that quite clear. It works in conjunction with professional associations. So professional associations are meant to look after the profession's interests, and Aronah certainly isn't meant to stop that or replace that. Aronah is meant to look after the public's interest. Having one organisation that tries to do both, you're bound to get conflicts. So it's meant to be complementary to rather than competing with the associations. So these are the guiding principles. One of the ones that I really like to put across here is that registration in Australia is quite different to registration in other countries. So regulation in Australia is quite different to regulation in other countries. So in North American jurisdictions, for example, regulation is based on licensure. So if you look at the actual code, you've got individual acts that practitioners can do of a certain type. In Australia, they don't actually restrict acts as much as actually create barriers to entry, which is the register part. So to be eligible for registration on that register, you have to come from, have this sort of eligibility, whether it's degree, whether it's been practicing or whatever. And restrictions on the practice of a health profession are actually to be imposed under the scheme only if it's necessary to protect public health and safety. And in the actual registration legislation, there are only 3 restrictions. So CV manipulation, so not manipulation, but just CV manipulation has been, sorry, not CV, CV, sorry. That's been restricted to chiropractors, osteopaths and medical practitioners with appropriate training. Prescription of optical devices has been restricted to optometrists and medical practitioners, and dental acts have been restricted to dental professions. So they're the only actual restricted acts under the profession. So that being said, the register is actually based on what they call professional conduct. So professional conduct implies practicing in a manner of which you've been trained appropriately. So if you start performing minor surgery, for example, without that training, that's unprofessional conduct because you don't actually have that training, for example. So naturopaths that have, for example, a history of physical manipulation will still be able to do that manipulation as long as they've got the appropriate level of training, apart from that CV manipulation. If a naturopath who's never done physical manipulation harms a patient, then that can be a breach of professional conduct because they've not actually had the appropriate training. So if you try something outside of your scope of training, that's when unprofessional conduct comes in. So that restriction thing has been, so it's not about writing down a list of herbs that you could use or nutrients that you can use. It's actually about professional conduct and not causing deliberate harm to the patient. The objectives, and I'm talking about the accreditation scheme, but really these are exactly word for word in the Constitution as well. So one of the things that I do like to actually show in here, these are the actual, it's quite a broad sort of way of doing things. And one of the protections for practice here is, F, to enable the continuous development of a flexible, responsible and sustainable health workforce and enable innovation in the education of and service delivery by healthcare providers. So it's not about restricting them to a certain scope, it's about actually making sure that that scope is safe. So one of the things they have found in some, particularly onerous jurisdictions is that if you tell practitioners what they can and cannot do, that can actually stifle innovation and stifle the development of new therapies, for example. Next one. So the reason why registration for naturopaths and herbalists is being considered is simply the success of the profession. So it's quite a large profession now. We don't actually know how big, between 3,000 and 10,000, depending on what source you actually have. 10%, this comes from the longitudinal study of women's health data that we've actually been doing. About 10% of the Australian population see a naturopath or herbalist regularly, and this is pretty old data now from 2004. We've looked at more recent data and it's a lot higher. When you're looking at complex conditions of vulnerable populations, 16% in cancer, 25% in anxiety, and about a third of these patients are seeing them as their primary care provider. Where, for those that are a bit worried about registration, I guess they can think of it in terms of, victims of our own success. It's become a part of the healthcare workforce that's too big to ignore. So responsibility and accountability are being introduced at some levels or being considered by other levels for naturopaths and herbalists. And the other thing is, of course, that 10%, there's no protection of title. Naturopaths has become an established brand, I guess, in Australia. So there has been some co-option of the brand. About 10% of naturopaths have no formal qualifications at all. And they're only the ones that actually admitted having no formal qualifications. So how many are actually out there is up for conjecture. So in terms of a breach of conduct, what would constitute a breach? This would be Aronah or any registry body can only really act on complaints it receives. It's not about policing the industry and actually finding complaints. It's about actually acting on complaints it receives. So there's no, you won't find hidden webcams in your clinics or or anything like that. It's actually requires a patient to actually make a complaint. So any breach of professional conduct or standards. So these standards are actually developed by the profession, by your peers, by naturopaths and herbalists. So, for example, if you are looking at the risk of misdiagnosis, for example, the risk of misdiagnosis for cancer would be, the expectations would be a lot higher for an oncologist than they would be for a naturopath, for example. So, you can make mistakes. It's the intent that's more important. So some standards are across the profession. So, things like monopolisation of care or exploitation of patients. So financial exploitation of patients is something that it has been, suggested that some parts of the naturopathic community do. And usually that's through protocol-based medicine or, those sorts of, walking out with $500 worth of product or whatever. So, And a lot of this comes from not so much what you sell patients, but the informed consent. So if you're looking at product sales, we just had an article published in the Medical Journal of Australia looking at how product sales of complementary medicines fit within the national regulation system. And it's okay as long as you inform the patient of the cost, inform them of how long these therapies can be expected to be taken, give them options of purchasing, and actually, if there is a financial interest, inform the patient of that financial interest. So it's about informed choice for the patient. It's not about stopping practitioners from having certain scopes of their practice. Accidents can and will happen for most practitioners, and I have left a T off the end of that, so that's kind of, there's one accident, I guess. But the breach only occurs if the patient puts it, if a practitioner puts the patient at risk knowingly, deliberately, or through incompetence. So in terms of incompetence, I guess a good example is St John's wort, for example. Most practitioners should be taught in most courses now that St John's wort has similar action to SSRI antidepressants. So giving high doses of that herb for someone who's on concomitant antidepressant medication could be seen as a breach due to incompetence, because most practitioners should be expected to know that. Giving a patient St John's wort who develops idiosyncratic allergic reaction, for example, but that wouldn't be a breach because that's an unforeseeable kind of accident. People will get gastrointestinal complaints from some herbs. People will have violent reactions to some herbs that are just unforeseeable. These things are okay. You're allowed to give treatments that don't work. Sometimes treatments just don't work. It's if you put the patient at risk by refusing to modify your prescription, that's when it becomes a breach of professional conduct. And there's a really good example of that coming up. Here it is. So this is the kind of thing that would be a breach of practice. So this is a naturopath from Cairns who gave a gentleman who'd fallen off a horse a comfrey poultice and told him to eat turmeric, and actually didn't modify that prescription even though he'd been to see her quite a few times after that. The wound got progressively worse and worse, and the infection actually spread to the meninges. So the problem here wasn't what she gave him, it was the fact that she continued to try and give that despite the obvious non-effective treatment. So it's not what you give that's important, it's the actual, the incompetence that actually comes when clearly, I do hope that everyone here would think that, if someone came here that had a hole like that turned into a hole like that, then they'd actually start to think something would be wrong and refer on. This woman actually actively dissuaded the gentleman from referring to a medical practitioner. So that's the kind of, these egregious acts are the kind of things that registration's been put in place for. It's not for minor instances, the sort of, giving someone zinc and, they get a little bit nauseous because they had zinc because they forgot to eat. That's not something that Aronah or any registry body's going to come down hard on. Next one. Most of you probably know of Michael Wilson, the Melbourne naturopath that was charged with a number of sexual assaults. Again, it's these kind of large offences that put the public at risk. So most practitioners do practice in a safe manner. Most practitioners don't put their patients at harm, but some do. It's a very small minority, but it's a minority that the public needs to be protected from. So these are the kind of egregious natures of complaints that we're discussing.